Difference between syndrome of inappropriate antidiuretic hormone secretion and diabetes insipidus. Syndrome of inappropriate secretion of antidiuretic hormone and diabetes insipidus. Two disorders related to antidiuretic hormone, but the exact definition of opposite disorders. This video will definitely help clarify all your doubts about this condition. So do stay tuned. Though called as the syndrome of inappropriate secretion of antidiuretic hormone, just remember that in this disorder there is an excess of antidiuretic hormone. Now if SIADH is excess, then definitely diabetes insipidus is deficiency of antidiuretic hormone. Antidiuretic hormone is a hormone secreted by the posterior pituitary gland and is a hormone that stops diuresis, that is, production of urine. Its main function is to regulate fluid volume by decreasing fluid excretion as urine. It acts on kidneys and blood vessels both to preserve fluid levels in the body. When this hormone is in excess, it causes too much retention of fluid in the body, while when it is less, it allows too much excretion of fluid from the body. Thus, in diabetes insipidus, there is dehydration, while in SIADH, there is hypervolemia, that is, increased fluid levels in the body. The best trick to remember this disease is D for diabetes insipidus and D for dehydration. That is, in diabetes insipidus, there is dehydration which will occur if urine output is too much, and urine output will occur too much only if the antidiuretic hormone is less in the body. The reason these disorders are so confusing is because of the double negatives that it consists of. Continuing from dehydration, the dehydration leads to high sodium levels in the blood, called as hypernatremia, while in syndrome of inappropriate ADH secretion, the sodium is further diluted by excess fluid, causing lower levels of sodium in the blood, termed as hyponatremia. The symptoms of dehydration in diabetes insipidus includes hypotension, tachycardia, and dry mucous membrane. The person feels thirsty again and again, and this is also one of the reasons why diabetes insipidus is called as diabetes even though it has no relation with insulin. Symptoms of high fluid volumes in SIADH usually occurs as a result of complications such as pulmonary edema, wherein there is swelling or fluid accumulation in the lung tissues. This causes breathing difficulty, frothy sputum, cough, palpitations, wheezing, etc. Since this hormone mainly affects the kidneys, the urinary symptoms also occurs. In diabetes insipidus, the urinary output is high, while in SIADH it is low. The urine is diluted in diabetes insipidus but concentrated in SIADH. Also, the specific gravity of urine is high in SIADH but low in diabetes insipidus. So, we have high but diluted urine output with low specific gravity in diabetes insipidus and low concentrated urine output with high specific gravity. Coming to its treatment, SIADH is treated with fluid restrictions and correction of hyponatremia. Diuretics are also prescribed to eliminate excess of fluid. In diabetes insipidus, the patient may be prescribed medications like vasopressin or desmopressin, which acts like an antidiuretic hormone. A low sodium diet is advised and patient is advised to stay hydrated. So this is all in SIADH versus diabetes insipidus. For any queries, please do leave a comment in the comment section. Please do like and subscribe our channel and see you soon.